Hello, we are Team CathCollapse, and today we'll be walking through our project, the no-look heart repair. To begin, we'd like to first introduce our team sponsor, Dr. Kella, whose help was invaluable throughout the semester. I am Audrey Tinsky, and today I'm representing my teammates Phoebe Shutt, Maddie Trousset, Lauren Harris, and Caitlin Cratchin. Let's first discuss some background in order to better understand the unmet clinical need our device solves. Here you can see the anatomy of the heart. The flashing blue section is called the pericardium, a thin layer that surrounds the heart. It contains a small amount of fluid which serves to lubricate the sac, allowing the heart to beat and move around. However, the heart tissue can sustain damage even during routine EP and cath lab procedures. This causes blood to fill the small sac, compressing the heart and preventing proper blood circulation. This is known as cardiac tamponade. Current treatment is pericardiocentesis, so let's learn about what that entails. Here, we see a green needle inserted into the pericardium and fluid is drained quickly. Typically, this happens under some sort of imaging guidance. However, if the damage to the heart is too severe, patients will need to be rushed or transferred to the operating room for open heart surgery to repair the damage. We, as Team CathCollapse, are trying to get rid of this unnecessary escalation altogether. This is why this is not only a great decision for patient outcomes, but a great business decision too. Let's run through the numbers. Each year, there are 1 million pericardiocentesis procedures performed worldwide. With estimated prices between $6,000 and $7,000, our total addressable market is about $7 billion. A smaller subset of these procedures is the 200,000 procedures that are performed within the United States, yielding a serviceable addressable market of $1.4 billion. Finally, given the incidence of 1 to 2% of these cases necessitating open heart surgery, we have a serviceable obtainable market of $28 million. In order to present a complete business case, we can't just discuss our profitability, we also must address the substantial cost savings this project promotes for patients and hospitals alike. In 2024, the United States healthcare system spent $81.2 billion in medical liability costs. If we mitigate the possibility of a patient undergoing open heart surgery unnecessarily, this will undoubtedly save money. Moreover, these patients who would have been discharged within the same day given the routineness of most EP procedures will now require at least 4 to 5 days of inpatient care after undergoing this open heart surgery. In 2022, 1 day of inpatient care cost hospitals $3,025. At this rate, one patient staying just one extra unnecessary day every day of the year costs hospitals an extra $1.1 million. So how do we intend to solve this unmet clinical need? We present an innovative multi-lumen drainage catheter leveraging the pericardial sac's natural anatomy for simultaneous drainage and hemostatic agent application. Let's walk through how our product integrates into the current pericardiocentesis procedure. After guide wire access is obtained within the sac, our catheter encircles the heart and automatic suction is applied for the drainage of fluid. The catheter creates a negative pressure that collapses the pericardium against the myocardium. In other words, we're applying pressure to the perforation to reduce blood flow into the sac. During this drainage, medication may be delivered through one of the device's lumen to ensure permanent wound closure. The device is highly patentable. There are currently no other products on the market that allow for drainage and fluid administration through each lumen. There is also no other multi-lumen catheter being used to treat pericardial effusion. Now we'll walk through the bench test setup that consists of a base or acrylic board with a 1/4 inch diameter hole resembling a perforation in the myocardium. Surrounding the base is a thin latex sac that mimics the pericardium. The catheter is inserted into the sac and connected to a suction pump at one of the ports. A DC water pump is then connected to the hole in the board. Here, we have a demonstration of the sac collapse in our model. Once the excess fluid is drained, the sac collapses against the perforation and prevents the continuation of fluid flow into the sac. Our bench testing demonstrated a 95.4% reduction in flow, confirming the efficacy of our product. To contextualize our results, we successfully collapsed the sac against a bleed at a pressure similar to that of the heart's atria. So what are our next steps? To advance this project, we've outlined 4 categories we hope to expand in to achieve a shelf-ready product. First is prototyping, specifically using injection molding to produce a scaled-down polyurethane prototype. We then will utilize Mayo Clinic's anatomical modeling unit to print human heart models that we will strategically puncture in varying places to understand how our device will close perforations in different locations. We will then test in cadaver labs to show proof of concept with actual heart tissue. And then we plan to focus on regulatory submission to get a provisional patent in order to protect this idea from competitors. Thank you so much for taking the time to learn about Team CathCollapse's no-look heart repair. We hope that you are ready to join us in paving the way for safer, more accessible treatment options for patients everywhere.